PhD in health psychology at the University of Sydney in 2017, focused on how technology might be used to help binge drinking in young adults. She then went on to do some postdocs at the University of Aberdeen in the UK and at the National Drug and Alcohol Research Centre at UNSW. And there she worked on projects related to substance use and behavioural addictions. So lucky for us, in May 2020, Dr. Black rejoined the University of Sydney, this time basing herself in the Technology Addiction Team and Gambling Treatment and Research Clinic at the Brain and Mind Centre. And here she's working on projects that are focused on understanding the role of technology in mental health and addictive behaviours such as gambling. And today, Nicola's going to tell us about gambling and related problems during the COVID-19 pandemic. All right, thank you, Nicola.
Okay, thank you very much, Claire. It's a real pleasure to be back here at the University of Sydney, but also to be here today to tell you a little bit about our latest findings. So we only finished collecting these data last week, so you are the very first people to be hearing about what we've found in terms of Australians gambling during this COVID-19 pandemic. So gambling is quite a common activity, and many people engage in gambling without experiencing any substantial harms. But for a small minority of people, the gambling will be associated with substantial harms in the form of gambling disorder. And what this can look like is quite a lot of difficulty in controlling or cutting back on one's gambling, even if somebody wants to. And when we try to cut back on our gambling, we can feel quite restless and irritable in this process. We might also use gambling as a sort of a coping mechanism when we're feeling distressed, something to turn to and distract ourselves. And it might start to impact other areas of our lives. So we might start lying to our loved ones, and it might impact our relationships and work. And here in Australia, we have one of the highest rates of availability of gambling products in the world. So you can see here we're 6th in the world in terms of electronic gaming machines or pokie machines, and we have almost 200,000 of those across the country. And this is quite notable, especially considering Australia's relatively smaller population compared to some of these other countries. And in terms of our financial losses, we're actually losing the most per capita of any country in the world. So you can see here, we're losing almost $1,000 each per year. And that's almost, or it's about double the rate of most other of the highest countries. And when we look at where we're losing this money, the most common kind of modes of gambling are some land-based ones, such as pokie machines and casino gambling. And these account for about 3/4 of the financial losses we're experiencing here in Australia. Which brings us to the COVID-19 pandemic. As we all know, this has had huge changes in a lot of features of our day-to-day lives. We've completely shaken up our work environment. Some of us have lost our jobs. We've changed our ways we're getting around, and we, for a period, lost a lot of our normal leisure activities, so gyms, restaurants, pubs and clubs, many of which include gambling products. And we've changed our ways of socialising as well. And we're already seeing that all of these shifts to our environments and our daily routines are changing the way we behave as well. So evidence that's come out just this year has shown that during the COVID-19 pandemic, Australians have been drinking less alcohol and at less risky levels, engaging in less casual sex, and engaging in less exercise as well. And here at the Technology Addiction Team and the Gambling Treatment and Research Clinic, we were really interested in understanding how is the pandemic affecting Australians' gambling. And as we all know, there was a significant period of lockdown between about March and May, but in terms of gambling, what this meant was that a lot of the really common forms of gambling were completely unavailable to us. So we couldn't access pokie machines, casino games, poker in venues, because all of these venues were shut for a substantial period of time. And at the same time, it also had an impact on some of the other forms of gambling, such as sports and race betting, because a lot of these events that people might bet on were cancelled due to the pandemic. So this presents a really interesting opportunity and a really unique opportunity if you think about just the kind of high rates of availability of gambling products in Australia, to be presented a situation when all those products became unavailable. And what we wanted to look at was, what's the longer term impact of that? So during this 2-month period when we didn't have access to all of those gambling products, aside from some online gambling, what impact does that have on our gambling behaviour and any experience of gambling problems once those restrictions are eased and we go back to closer to normal life? So to address this, we conducted a 3-wave online survey. So first in May, we recruited 462 people and we asked them about their experience of any gambling problems and their engagement in gambling across a range of different modes of gambling, such as the pokie machines, sports betting, race betting, lotto. And we asked them how much they were engaging in all of these things at that time point and how much they were engaging in them pre-COVID, so before all of the shutdowns. We then followed these same people up 2 more times in August and November to try to understand how their behaviour and their experience of problems was changing over time. So to be eligible, you had to be residing in Australia, aged 18 or older, and you had to have gambled in the past year. And here we have just a bit of info about the sample we recruited. You can see that all of the states and territories were represented, but most of the participants were drawn from the eastern states. And in terms of sex, we had quite a bias towards male participants, most of them being male, and aged about 45 years. And in terms of participants' SES, you can see here that participants were relatively more advantaged than the general population. So their level of neighbourhood advantage was higher than average. And there was also about double the rate of tertiary education as we see in the general population. In terms of their mental health at baseline, you can see here that their general psychological distress was at a subclinical level. But in terms of gambling problems specifically, we see quite an overrepresentation of gambling problems in our sample relative to the population. So as I mentioned, 1 to 2% of people will experience gambling problems, but here we have about half of the sample experiencing high or moderate risk level of gambling problems. Now looking at the types of gambling people were engaging in pre-COVID, you can see that the most common types were race betting and sports betting, and people were doing that both in land-based venues and online. And the other common ones were lotto, again land-based and online, and electronic gaming machines or pokie machines. You can see about 18% of our sample were using the pokies at least once a week. And in terms of the regularity of gambling, you can see that about half of the participants were gambling in venues at least once a week. About 78% were gambling online at least once a week. And the vast majority, 85%, were gambling in some modality at least once a week. So this is a sample of quite regular gamblers and a lot of them gambling online. And now in terms of the frequency of gambling pre-COVID, you can see that in terms of land-based venues, people were gambling about kind of 1 to 4 times per week, most people. In terms of online gambling, people were gambling about 2 to 7 times per week online, and overall about kind of 3 to 10 times per week gambling in any form. So that's kind of sort of almost daily to more than daily. Most people were gambling. In terms of our analyses, we pre-registered these on the Open Science Framework before we downloaded the Wave 2 and Wave 3 data. We conducted repeated measures and others with planned contrast to compare participants' gambling frequency and their gambling problems in August and November with their pre-COVID levels. And we first did this by looking overall at our sample, and then we were also particularly interested in looking at what's happening for the people who were experiencing those moderate to high levels of problems at baseline, because this is the real kind of at-risk group. And in any longitudinal study, people will drop out at the subsequent waves, and this can introduce bias into the analyses because the types of people who stay in the study tend to differ from the people who drop out in important ways. So we used multiple imputation to try to counter this bias. And just for the present analyses being presented in this presentation, we focused on participants residing in all states except Victoria, because as I mentioned, we were quite interested in the lasting effects after the lockdowns were eased. And as we know, Victorians experienced a substantial second lockdown period, and this kind of spanned the duration of our study. So what did we find? Are we gambling any less frequently now than before COVID? The short answer is yes. We did find a significant reduction in gambling frequency in both August and in November compared to the pre-COVID levels. So you can see here before COVID, people were gambling about 34 times per month, and this reduced to about 31 times per month in the subsequent rounds. But when we looked at the subsample who were at that moderate to high risk of gambling problems, we didn't see any significant reduction in gambling frequency. So adding to the existing literature, which is showing that we've changed our behaviours in a number of ways, we're also seeing reductions in our gambling. And what's particularly interesting about this is if you consider the timing of the period of lockdown versus when we assessed people. So the lockdown was kind of March to June time, and we are seeing reductions in gambling frequency here 3 and 6 months after this lockdown period. So fairly sustained changes in people's behaviour. At the same time, if you look at the size of effects, they're quite small. So if you convert it to number of times gambled per week, you can see pre-COVID people were gambling about 7.9 times per week, and most recently in November, people were gambling about 7.2 times per week. So significant reduction, but fairly modest reduction. In terms of our problems, have there been any changes in our experience of gambling problems? The answer is no. We didn't see any significant reduction in gambling problems in the overall sample, nor in the subsample of people who were at moderate to high risk of problems to begin with. So overall, we are seeing that some people are gambling less, but it wasn't those who were experiencing the problems at baseline. So this implies that it's primarily those who were gambling at low risk levels to begin with that have reduced their gambling engagement or frequency of gambling. And we also didn't see any reduction in the experience of problems themselves. So what does this kind of mean? Well, I referred to the 3 and 6 month timeframe in terms of sustained changes in behaviour as fairly long. But if we take a step back and think about the course of addictions more broadly, then these are things that can affect people for years or decades of their lives. So in this kind of timeframe, would we expect to see changes in the problems themselves in the 3 to 6 month timeframe? Perhaps not. And thinking about this same time frame, it might be that people are taking some steps towards improvement or recovery, but given that we can expect this to take quite some time, the size of the effects seen during our study period might be too small to detect. At the same time, this might be an opportunity because we know that we have effective therapies for people who are experiencing problems with their gambling. But at the same time, it can be difficult for people to make that call and get themselves into treatment. There are barriers people experience, stigma, and these things can result in delays in getting help. But we're seeing from some of the qualitative responses in our survey that people are thinking about their gambling at the moment. Perhaps we're not seeing significant changes in the problems, but perhaps people are feeling a bit more ready to have that conversation. So if that's the case, then perhaps promoting our effective therapies at this time could be a good opportunity. And as I mentioned, our sample we had about half of people were gambling regularly in land-based venues, but we also had quite a sway towards the online gamblers. And it would be really interesting to know what's happening for the primarily land-based gamblers, particularly as we know that some forms of gambling, such as pokie machines, tend to be more associated with problems than others. So it would be really interesting to know how are those people going in the post-lockdown period. And I'd just like to take a moment to thank all my wonderful collaborators on this project, as well as the Gambling Treatment and Research Clinic for supporting this work. And of course, a big thank you also to the hundreds of participants who volunteered their time so generously to participate in this study, without whom it wouldn't be possible. Thank you very much.